Okay. Hello, my name is Dr. Sandra Hardee, and I'm the Medical Director of Occupational Health Services with Prisma Health. I'm going to do a video today. This is part of our series we've been doing for about a year now on occupational health services, and a topic today is going to be on bloodborne pathogens. So, bloodborne pathogens, that's sort of a mouthful, I know, but it's a situation where you have an employee who's been exposed to human blood that could potentially be contaminated with an infectious disease. So, if they have an exposure at the workplace, they need to come to us for an evaluation. So, that's the snippet of information on it. Now, we're going to delve in a little deeper on that. I'm going to share my slides with you. Getting a little better at this each month, folks. So I'm very proud of that. So here we go. So as the topic says, bloodborne pathogens, workplace exposures. In 1991 is when OSHA announced the implementation of this standard. If you've ever looked through an OSHA manual, those that run plants and run any kind of business really these days are familiar with it. And you have the different codes of federal regulation. And so the standard in the OSHA manual is 29 Code of Federal Regulation. It's 1910.1030. And I have the link here that has all the information related to this topic. So this was an important aspect in terms of preventing injuries, as far as preventing exposures in the workplace and also protecting workers. But the standard also obviously goes over what to do in case you do have an exposure. So what are bloodborne pathogens? So these are microorganisms that are found in human blood that can be infectious and they can cause diseases in humans. So the primary ones that we screen for and consider are hepatitis B, hepatitis C, and HIV, the human immunodeficiency virus. And most people are familiar with all of these. Just going to spend just a minute or so on what these different viruses can cause. So for hepatitis B and hepatitis C, very similar in symptoms if an individual has this. It can be from nausea, vomiting, they can have abdominal pain, they can have jaundice where the skin or whites of their eyes looks yellowish. They can have weight loss. So very fatigue is also another common symptom. So very similar symptoms. I do have on my slides hepatitis B. There's about 12 million people in America that are affected with it. It's a silent infection. People don't know typically once that initial symptoms happen, the symptoms can resolve, but then over time can do damage to the body. And the important thing about hepatitis B that the virus can actually remain alive for about a week in dried blood, so it can be transmitted more easily than the others. Hepatitis C is also a very common chronic bloodborne infection found in the U.S., and it can lead to chronic liver disease that can actually cause death. And then HIV, most people are familiar with it, that it could potentially lead to AIDS, which is a syndrome of symptoms that individuals can have or diseases. It affects our body's immune system. And once you have that virus, you're infected for life. Fortunately, with HIV, there's some very good therapies now to keep that under control. Risk of exposure. So what are the risks? What causes an exposure? So most people, get the first one, needle sticks, very, very common. They may not think, though, how those needle sticks occur. We tend to think of in a healthcare setting, you have an individual that has blood drawn by a lab personnel or a nurse. And sometimes once they withdraw that needle, they can stick themselves. There are specialized caps on needles now that help prevent that and have really reduced the risk of these needle sticks, but they still can occur. But other things you may not think about are individuals in certain lines of work where they may be stuck from a needle. For instance, a police officer who may be frisking a potential assailant they may have a needle in their pocket. They may get stuck that way. Also, garbage collectors, sanitation workers, there may be needles in bags and they can still have gloves on, but those needles can go through those and they can get a needle stick that way. Another can be cuts from sharp objects. Say a law enforcement person, we've had this where an assailant, goes through a window, gets cut, there's blood on the glass, and then they, in pursuit, cut themselves on that sharp edge and there's blood there. That can be an exposure. And then the last one is contact of mucous membranes, thinking in the mouth, or broken skin that's contaminated with blood. So think about an open wound that's bleeding on someone, or think of human bites. And unfortunately, that's a common one. Someone gets bit, there can be an exposure in that situation as well. So I alluded to this just a second ago. What are occupations that are risk? So think of healthcare providers, first responders, housekeeping personnel, say they're responsible for laundry, and think of all the different kind of companies that may have laundry on site that has to be cleaned. There could be a sharp object in that or a needle in that that could stick them. Sanitation workers, school teachers related to human bites, law enforcement officers, dental assistants, any kind of folks in the dental world are at risk, obviously. So the OSHA requirements are very straightforward. There's several of them, but I'm going to just go over the highlights here. So you need to establish an exposure control plan. So the exposure control plan has in it all the policies. What is an exposure? The definition. What are the policies around what happens after an exposure occurs? There can also be in that plan cleaning, like how in a specific area in your workplace, how an area is cleaned, how often it's cleaned and decontaminated, how waste is disposed of. So that plan can be a pretty wide breadth of information in it, depending on the kind of company that it is. And it should be, as it says under number 2, be updated each year. Obviously, an important part of your responsibility is to implement the use of personal protective equipment and provide that. So obviously, unfortunately, after COVID, we're all too familiar with this. It's talking about masks, goggles, gloves. It may involve a gown, just depends on the workplace and what your employers are exposed to. Also, if you are in an environment that your employees are at a higher risk of a potential bloodborne pathogen, it's very helpful and recommended that you go ahead and make hepatitis B vaccines available to your employers so that they can go ahead and get the vaccine series so they already have immunity. So in case they are exposed, you don't have to worry about them developing that infection or that illness. And then finally, obviously, as part of your plan, you want to have available a plan to send your employee for a post-exposure evaluation and follow up with that person for any exposure, or follow up with that healthcare provider, I'm sorry, for that exposure. So when an exposure occurs, first things first, you want to, if it's a needle stick or a cut, you want to wash that area with soapy water, wash it for at least 5 minutes. Gets any kind of viral load or bacteria out of that wound. If it's more of a splash into the eyes, into the nose, mouth, or on the skin as well, you want to flush that area with as much water as you can for at least 5 minutes. Same thing, particularly with eyes. You want to try to irrigate the eyes. It's a challenge to do that, but you do want to try to irrigate with water for at least 5 minutes. After that, you want to notify your manager or supervisor immediately. And that's when that supervisor is going to rely on that exposure control plan to go through, make sure that you document everything, how the exposure occurred, and then direct that employee to a healthcare professional such as us, an occupational health provider, in order to assess them and to treat them. Next slide. So what we do when we see folks that's had an exposure, obviously it's a confidential evaluation. We sit the patient down, we will talk about the circumstances, how they were exposed. Was it a needle stick? Was it a bite? Kind of get information on how much blood was involved. Was there any blood drawn? What exactly the circumstances are. And then we'll talk to them about if we can identify the source individual. And this is where it gets a little tricky. So if you think about a healthcare setting, if someone's in a doctor's office and getting blood drawn, and that employee gets stuck, it's very easy to identify the source of that blood. And that makes it easier to help determine what that employee was exposed to. That sort of changes our algorithm where how we work with that individual. I won't get into the details of that, but that does make a difference. But unfortunately, a lot of the situations are we don't know the source, and that's the example of the law enforcement officer stuck with a needle. Sanitation worker gets stuck with something with a needle. Someone in housekeeping gets stuck, getting garbage out of the needle or something was placed in there inappropriately and gets stuck. So in those employees, we don't have the source. So we do counsel them extensively over, uh, the risk of what they've been exposed to and what our plan would be, what our recommendations would be. Um, we then can counsel on doing some blood tests to look for serological status for the hepatitis B, hepatitis C, and HIV. And then once we get that information back, we can counsel them further on what next steps are. There are instances, you'll see on this list here, the post-exposure prophylaxis. There are some instances where if we feel like the exposure was very significant, that we may go ahead and start treating that individual. Depends on the situation. So these are all very, very individual situations. And that's why it's hard for me to get really into the nitty gritty on the details what we do with folks because they are so individualized. I'll give you an example. I'm going to stop the slides here. I'll give you an example. For instance, you may have a school educator who's bit, a child bites them, the child draws blood. So then technically it's a reverse exposure because then once they draw blood from that arm of that educator, you worry about the educator's status. Could they have infected the child? So it gets a little tweaky sometimes with these. And that's why it's hard to give you sort of a definition of exactly where we go. But believe me, we know what to test for. We evaluate the individuals, figure out what the risk is, counsel them on them, draw lab work if appropriate. And then if they need further follow up over the next several weeks, we'll do that and counsel them along the way. So this has been sort of a high level discussion over bloodborne pathogens. It gets a little challenging sometimes, but feel confident that we know what we're doing when we see these folks. Main thing for y'all to know as an employer, you want that exposure control plan. You want your folks to have good PPE. If there's an incident, wash, 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 talk to the manager and get them in for an evaluation. So I hope this has been helpful. It's a very interesting topic and one again that's not too uncommon. So I appreciate your time. If you'd like, you can always check out on Prisma Health, the website, look up Employer Health Services. You'll see some information about all the services that occupational health can offer for your company. We can do that at our 4 locations. We have offices in Greenville, Seneca, Columbia, and Sumter. We also will go to businesses to do screenings. We can also offer 24/7 if you need it, staff on site. Whatever you need, Prisma Health can meet them. So I appreciate your time. Thank you.